Get in there, lad. Make that point. Oh, yeah. You get me right down Don't go believing anything I say. No, don't go believing me. No, don't listen to me. Don't take any notice. Don't listen to anything that I say. Thank you.
Good afternoon and welcome to today's Downing Street coronavirus briefing. I'm joined today by Professor Steve Powis, the National Medical Director of NHS England, and General Sir Gordon Messenger, the Head of Operations for the Community Testing Programme. Tomorrow night, our national restrictions in England will come to an end. And subject to the vote in Parliament, we'll return to the tiered system from Wednesday morning.
So we're only going to be in the tiered system if they get it voted on. I wonder if some of them are going to be kicking off about it because they're not right happy about it. And that's all your group in your little clan. Not happy.
I know that the national restrictions have been really tough for some people. But the good news is they've been working.
How have they been working when the cases rates have been falling prior to your lockdown?
Let me take a moment, if I may, to run through some of the numbers.
Numerical drivel because, well, just spout your bullshit, then you can make it sort of seem as though it's real in your head. Go on. Been doing it for a long time now. Should be used to it.
Today's study from Imperial College shows that the national restrictions have brought down cases by a third.
Brought down cases by a third? I don't reckon so.
Over the last week, the average number of positive tests is now 14,778, down from a peak of 25,331 on the 16th of November.
Ooh, bigger numbers compared with last week. Out of how fucking many? You neglected to state that. Because you'd be giving people the impression that you're still doing only, 100,000 tests? And that's what you were basing your figures on before. So if you're now doing closer to 250,000, wow, that's nearly 10% of the people. Bit of a big fucking drop from the PCR test, isn't it, pal?
Today, there are 15,712 patients in hospital right across the UK with coronavirus.
With coronavirus? Right, which one exactly? The family of viruses, which is the common cold, which is what everybody reckons you're actually just mainly testing for and sticking them in hospital, regardless of whether it's actually a COVID test? Or do you mean COVID? Because you just talk fucking double-ended words with double meanings, and people are fucking sick of it.
That is down from 16,612 on the 23rd of November, a week ago.
And before the peak, and even during the peak, and when you started testing, it was a different fucking test. So it makes it a bit fucking irrelevant, you dipstick. You're an accountant and you can't even do fucking numbers. You're a fucking retard.
In England, in the week before the peak, the number of cases grew by 11%. But in the last week, cases have dropped by 30%, almost a third.
Oh, there we go again. See, it's that numerology thing. It stands out a bit of a mile. 30%, almost a third.
This is clearly good news. It shows that the national restrictions have been successful.
So the restrictions have been successful. How do you reckon that, really, exactly? Because there's still people mingling and they're not all dropping dead and they haven't all got it. So how do you figure the restrictions are working, you pleb? Really? How do you reckon it? The only thing I see you actually being good at is demolishing this fucking economy. Not that you're actually helping anybody in the fucking health service or anybody with any fucking health problems. Yeah, just lock them all up in at home, just leave them there. Maybe it'll be another 33 days.
And what this means in practice is that through everyone's actions in respecting the national lockdown and through everything that people have sacrificed, we've reduced pressures on the NHS, we've brought down the number of coronavirus cases, we've got this virus back under control.
By virus, do you mean the people unwittingly harbouring an enemy of the state? You've got them locked up again in their houses, and that's how you're controlling everybody. You know, under the National Securities Act and the Anti-Terrorism Act and the Official Secrets Act. So you can use this type of shit to generate your lies that you can go through, to tell everybody that, oh, it's a virus you're locking up. No, it's not, it's you. The people who are actually sat at home listening to this bullshit, it's you they're locking up. When are you going to twig it in your fucking head? Go on, go and have a read of the legislation. By what they've said, it's a deadly virus. People are terrified. Anti-Terrorism Act. National Securities Act. If it's a terrorist threat, you've got to identify it. If you can, cut its funding off. That's on the National Securities Act as well. And then you've got the Official Secrets Act. It gives them the ability to lie to everybody under the interests of national security. So they've only worked because they fucking locked you up. Because that's where the virus is, because that's you. You're the fucking threat. You're twigging it yet?
And I want to thank you for that, and for the part that you've played.
I'd like to thank you for that, and the part that you played. For self-isolating, well, basically self-imprisonment. For getting all your ailments, staying at home, putting up with some shitty testing, having everything delayed if possible, supposedly saving the NHS shitloads of money, which it doesn't save the NHS, it saves the government actually shelling out what it should do, which is your taxes to pay for your health. And they want to thank you for that because they're actually spending shitloads of money on businesses, making profit, and handing out loans to what little businesses are left, and then ploughing more money into unemployed people staying at home. Thanks a fucking bunch.
The effect of the action that we take, of course, brings with it huge challenges too, especially for the hospitality sector. And as the analysis of health, economic and social effects of COVID-19 and the approach to tiering shows, which we've published today, it clearly demonstrates this action is necessary to avoid a much worse outcome. And we must be vigilant. There are still 14,778 positive cases reported every day, and there are still those 15,712 people in hospital with COVID. And sadly, there are still 460 reported deaths on average each day.
Oh, we've got a specific number being reported positive each day. Isn't that surprising? 14,000 and something each day. That's a bit of a fixed figure, isn't it? Every day. The viruses actually work like that. A fixed number each day. Mind you, I must applaud him. He's actually been trying to use sympathy. Yeah, but it doesn't really work, does it? It's about... I can't even describe how shit it is. Essentially, he equates to Riker off fucking Star Trek.
This is far too many. But there is light at the end of the tunnel. We know that together we can beat this, and we've got to stick at it. Putting this in technical terms, the R rate is back below 1, but only just.
Oh no, it's the dreaded R rate again. Oh, I wonder which set of figures they're actually using for that this week. I wonder, is it the actual data set they were using through the summer that didn't actually pan out because they didn't do it regular? Because, you know, when you test a whole bunch of people and only 150 people took part this week. So those figures are just shite. The ones off the PCR test are absolutely just rubbish. So I wonder what they're actually using this time. Makes you wonder, doesn't it?
When R is below 1, the number of infections falls over time because, on average, each infected person infects fewer than one other.
When air is below 1, it infects less than one other. Infects less than one other what? He doesn't get it, does he? Really? God, why do we listen to these absolute mongoloid idiots? It's the replication rate. And if you're reproducing a virus and you're not all snotty, that means you're not infecting anybody else. You just said it there. You're infecting less than one other, which means you're only infecting yourself. So if you haven't come out with it, then you're not spreading it around, are you? I mean, unless it's some other magical below 1 number. Honestly.
And for that to happen on average, it's important that lots of infected people infect no one else at all.
It's important for lots of infected people to infect no one else at all. Oh my god. Who's teaching these assholes? Are they fucking 12 years old or what? Yeah, if you've got a cold, stay at fucking home. Oh my god. And I'm sorry, these people are supposed to be leading this fucking country. I wouldn't fucking trust them to lead fucking kids around a park safely.
This is the central challenge of this pandemic, and it's made much, much more difficult because about 1 in 3 people with coronavirus have no symptoms at all.
So 1 in 3 people have no symptoms at all. Right, fair enough. That's because they're carrying a heavy viral load, which means their immune system must be holding it off. Interesting that, isn't it? Because they're not coming out with symptoms, so if they're not coming out with symptoms, that means their immune system's working. Why the fuck do they need a vaccine? Why the fuck do they need a test? But it's only 1 in 3. Well, if it's only 1 in 3 and your error rate's less than 1, it means nobody's getting fucking infected, are they?
But nevertheless, they pass the infection on to others. And that is why, even as we ease these national restrictions, we've got to keep some restrictions in place.
Well, how? See, if you've got an immunity to it, and you've got this thing that they call herd immunity, doesn't that mean that for one person to spread the immunity, they have to be passing it on to the next person? So, if they're immune to it, that means they're passing on their immunity. But you don't want that, do you? Because you don't make any money off that. Especially after investing taxpayers' money into a shitload of businesses. You want a return.
And hence the tiering system. So while we can let up a little, we can't afford to let up a lot.
Whilst we give a little, we can't afford to let up a lot. In other words, they want you to give up a shitload of your fucking freedom. Well, they don't give up anything. And essentially, take the lot. You know, like all of your freedom.
The success of our collective efforts means that from Wednesday, everyone in England, even those in Tier 3, can have some greater freedoms. But we don't have much headroom. We can't risk letting cases rise again, especially into Christmas and with the flu season round the corner.
Especially with Christmas and the flu season round the corner. And we're already in flu season. You know, that thing that's not being looked at, especially. You know, that thing with the same symptoms as COVID. Oh no, sorry. COVID's got the same symptoms as the flu. And you've already been rolling out the flu vaccine early. So that's why you've got even more numbers up, because you've got those showing symptoms of a vaccination that actually COVID mimics. Bit strange, that, isn't it?
The Prime Minister has published the government's COVID winter plan, which sets out the end to national restrictions and the steps that we'll take to help to bring life back to normal by spring.
Help to bring life back to normal by spring. You know, that 3-week period thing they mentioned. So if they're mentioning spring again now, you can kiss fucking next summer goodbye, can't you? You know, it makes sense. Multiply everything 3 times as long. It's just easier that way, isn't it? I mean, it was only supposed to be 3 weeks. Well, look, 3 months later. Oh no, we've got to increase it a bit. Oh, we're, what, 9 months? No, let's just round it off to 12. We'll just start from when we started doing that testing that doesn't work, and then we'll just count that as 3 lots of 3. Because they love the fucking 3s. Oh, yeah, they love the fucking 3s.
But even as we take those steps forward, we must keep our resolve. We've worked so hard and collectively sacrificed so much.
Well, what exactly have you sacrificed? I mean, right from the start, you gave yourselves, what, 10 grand? Because of COVID? While you gave everybody else a chance to claim with criteria. But you got 10 grand straight off. No questions asked. Well, have you given that back? Or are you not taking the 3 grand plus pay rise? Is that a real sacrifice for you? No, what have you sacrificed? Well, except, well, the economy. That's the biggest sacrifice you've actually made. You've actually stuffed up the way the government actually receives money from the taxpayer. Haven't you?
But we can get through this, and I know that hope is on the horizon.
I know. I know.
In the past fortnight, we've made some really significant progress on vaccines, and the NHS now stands ready to deploy a vaccine should one be approved by the UK's independent regulator. Today, Moderna, the American company, formally filed for its vaccine in America. Moderna has already been submitting data to the MHRA, the UK's regulator, for some time. And as we set out this weekend, we've secured 2 million further doses, meaning that we in the UK now have access to a total of 357 million doses of 7 different vaccines. And while we keep working on a vaccine, we've already built a huge testing capacity that we can deploy right now.
Oh yeah, Moderna. You know, that company that makes this mRNA vaccine. The one that in 2017 was literally flat on its ass, almost bankrupt, because it couldn't get its shit to work at all. Yet twice, in that 3-year period, British government, along with multinationals, all stuck a load of money together and invested money in them before all this shit started.
And I wanted to take a moment to talk through the next steps on testing.
Oh God, not more testing.
It's all about the testing. It's all about the testing. You've got to get tested. You need to get tested.
Oh, what a lot of shite. More testing for what? Have you not gained enough data yet? That's what it is, isn't it? You haven't got enough data off everybody, so you need more testing. You want to explain it even more and more. You want people to get so bored of it they'll just go ahead and do it. Not happening. Not going along with your bullshit. Plain and simple.
Since the start of the pandemic, we've built the biggest testing capacity in Europe, and it means we can use tests to do lots of things that we couldn't do before. In addition to our symptomatic testing programme and the rapid testing that we're now deploying in the NHS and across social care, we have the capacity to do more.
What? Symptomatic testing? We're going to test you just to see if you might have some form of coronavirus. And if you've got the sniffles, we're going to see if we can actually use a test to tell you that you've actually got a coronavirus that's giving you the sniffles. Has nobody actually thought about actually testing for COVID-19? You know, that disease. Oh, sorry, not disease, is it? No, it's the coronavirus. No, sorry. SARS-CoV-2. No, we're not testing for that at all. No, they're only managing to pull that up on a clinical test. For some reason. Is that because it only works against certain samples and you can't replicate it? Or is it because everybody's got it but the right component parts just don't show up in a test? So they can only really tell the difference if they do a clinical test and eliminate a lot of the material that shows up in a PCR test and the other test you've done, because the other test is just testing to see if you've got a cold. Because people get runny noses and stuff this time of year. It's to do with the atmosphere and the amount of moisture in the atmosphere, and you can get bacteria in your nose, so they don't know whether you've got a virus or bacteria or not. That's why you're having a symptomatic test, not a diagnostic test. You know, something to diagnose you with. I'm just wondering, just out of curiosity, because you've got to ask, does this fall under testing for negativity because there isn't actually anything to validate the test sample from you against anything in the test? So there's nothing to test against. Testing for negativity. Get in there!
Today, we begin the rollout of our university student testing programme and expand community testing. And we won't just test people with symptoms. Because of this problem of asymptomatic transmission, people who don't have symptoms but do have COVID, transmitting COVID to others.
Or they just haven't got it. So then, by rights, they shouldn't be under any restrictions whatsoever because they just don't have it. Even if they've been around people with any form of colds and flus and all the rest of it. What happens if you've already had this shit last year? You know, because it was going round last year. Loss of sense of taste, loss of sense of smell, even dizziness with some people. All sorts of odd little things carried on after you first got it. So if they've already had it, then they're not really going to get it again, are they? Because if they had, I'd be dead by now. Really dead.
We're going to test people who don't have symptoms as well.
We're going to test people who don't have symptoms as well. Well, aren't they on about making it a regular weekly test? So, by rights, if you did this weekly test, you'd actually be able to set up a proper and true error rate. Because they haven't used one yet. They've been using bullshit. So, because they'd be testing everybody then, and then seeing how a virus actually transmits, because don't forget, they have to learn everything from scratch. Essentially, this is a new virus, so we have to learn everything we can about it, because in the past, it's all been theory. They've ditched everything they've known before, and they're just flying by the seat of their arse with this.
This really matters, because by finding the positives, we can break the chain of transmission and stop other people catching COVID. In Liverpool, where over 300,000 people, both those with symptoms and those without.
Hold on. They've done testing all over. They brought it down by a third. You've done testing in Liverpool, and they've managed to bring it down by 3/4. Anybody not spotting this bullshit yet? Honestly. A third and 3/4 doesn't equate to the same fucking numbers whatsoever. He needs to go back and read that book about lying with statistics.
Where that testing has happened.
Yeah. You've done testing in Liverpool. Were they that... oh, yeah, aye, yeah. Get in there, lad. Make that point, you know. Oh, aye, yes. He's really in there, isn't he? Oh, yes. Oh, aye. He's getting it right now, lad.
They've managed to bring the case rates down by over 3/4.
They've only brought the numbers down by a third. Oh no, they've brought those down by 3/4. So they're going into a different tier. How many people are going to be kicking off now? Go on, and all get tested, because you can just return to normal earlier. When it's a failure of their testing, and doesn't that show that their actual previous tests were bullshit? Bullshit testing, bullshit figures, pure bullshit. It's not that difficult to figure it out.
And so on Wednesday, Liverpool will go into Tier 2, not Tier 3. Of course, I want to see this sort of success right across the board. So we're rolling out community testing much more widely. We've been working with those going into Tier 3 with colleagues from Scotland, Wales and Northern Ireland too. And today, with the publication of our community testing prospectus, we set out the next phase of that work to give Tier 3 areas a faster way out of the toughest restrictions, to support them to come down the tiers as has happened in Liverpool. We've already received significant interest from around the country, including from the West Midlands, Redcar, Warwickshire and Medway and others. And this offer is available all across the UK, and will be delivered in partnership with local authorities in Tier 3 areas and with devolved administrations throughout the country.
There it is again. It's an offer. It's not a necessity. You don't have to do it. It's an offer. If they're giving you an offer, that means they want something. What are you getting out of it, really? Ask yourself, what are you actually getting out of it?
Because by using tests that can turn results around in under 30 minutes, we can identify and then isolate people who have COVID, including, crucially, the about 1 in 3 people with COVID who don't have those symptoms at all.
Identify and isolate. Remember what I said earlier on? Terrorist threat. You want terrorist threat? Isolate them, identify them.
But can nevertheless pass the infection on. Because if you have COVID without symptoms and still infect others, that of course is a silent danger. You wouldn't know that you're risking lives around you. And so to anybody, if you're offered a test, please take it. You might just save a life.
Emotional blackmail. That's what it is. It's emotional blackmail. You could have a virus. It's an unseen danger. Oh, it's taking a step down from unseen enemy, isn't it? Isn't it? Taking a step down from that. It's an unseen danger. You know why now it's an unseen danger? Is because they're going to try applying this testing bullshit into the workplace, which means it's now health and safety. So if it's health and safety and you don't take a test at work, they're going to fuck you off. Because you'd be a danger.
The final thing I wanted to say is that it is all of our responsibility to keep ourselves safe, to keep our families, our friends, and our communities safe. That responsibility is on all of us.
How's about keeping the whole of society safe from lying, devious, underhanded bastards who'd manipulate the most simplest thing to get what they fucking wanted, which is screwing everybody over, and then essentially going with this whole, your industrial revolution shit and your ID bullshit, so as you can actually use it to fucking commercialise people. So as you can actually take their data freely, without charge, and then send it on to other people to make you a shitload of money. That's all this is fucking about, is money. Base, fucking degenerate, thieving bastards.
And I know that it weighs heavily. We've been carrying it for a long time now. But the light of dawn is on the horizon.
Light of dawn is on the horizon? Yeah, that normally happens every morning, mate.
It's the moment to stand firm until the morning. So we can look back and see clearly that everything we gave and everything we did, it was not for nothing, but so we could save lives and build back better for everyone.
No, mate. Ain't fucking taking responsibility for your fucking bullshit. I'll take responsibility for building you a nice little fucking cell, though. Stick you and your mates in it.
I now want to turn to Professor Powis to take us through the latest numbers on the impact on the NHS.
Thank you, Secretary of State. And today I'm going to present just a single slide. It's an update of a slide that I've shown before, which concerns COVID-19 hospital inpatients in England. And as you all know, as infection rates rise, so do, unfortunately, do hospital admissions for those who are sickest. And of course, in a minority of people, also that requires treatment in our intensive care units. And as I've shown you before, as infection rates have risen during the autumn from September through October into November, then usually with a couple of weeks lag, we start to see rises in hospital admissions and the number of people in hospital. And you can see in this chart that going through the autumn into November, we have seen increased numbers of people in our hospitals in England.
Yeah. That'll be the early rollout of the flu vaccine again, won't it? You know, that lag of a few weeks. Because you started that in what, late September into October? So we'll be seeing those figures creeping up and in now into the hospitals. You know, the ones that don't actually cope with the vaccine at all. Because it only works really well for about 24% of people who actually take it. So you've got anywhere from, up to around 65% of the people have symptoms. after the vaccine. I wonder how many of those are actually included in your actual testing results and your testing figures and your data. Do they actually show up at all, or do they just get lumped in because it's COVID symptoms? You know, the mimic.
Now, the national lockdown was introduced at the beginning of November, and we would expect it would be a couple of weeks, as I've said, before we begin to see the effects of that on hospitalisations. As the Secretary of State has said, we have the evidence that infection rates are now falling and have been falling during this period of lockdown, and we are now just beginning to see that translate through into hospital admissions, which have been falling, and into the overall number of people in hospital, which again in recent days has started to turn the corner and is now falling, and as you can see stood in English hospitals at 13,772 yesterday.
Take a fucking breath, mate. Fucking hell. Jesus. You fucking aqualunga, what? So, even if you went off the ONS figures, what you're trying to tell us is the actual infection rate has been going up and up and up and up and up, where the actual ONS figures have actually been showing it's been coming down and down and down. Now, the people you're putting into hospital are just based on the fucking sniffles, not actual COVID-19. So these figures, and who you're saying is actually in hospital, is a bit of bullshit. And it's been pointed out. And the infection rate's more coming down, and there's less cases, because apparently this lateral flow test, which isn't the PCR test which picks up any old shit, this lateral flow test has been showing up even less cases. So you're having to increase the fucking numbers by any means possible by saying, oh, look at all the people who are in hospital with the sniffles. Absolute crock of shit, mate. Nobody's fucking falling for it anymore. Not even me. And I never used to fucking take any fucking notice of this bullshit at all. And now you're shoving it down our throats, I'm going to shove it back up your ass.
Now, beneath this, there is some regional variation in the northeast and the northwest, where infection rates have been falling from a high base. We have similarly seen early falls in the number of people in hospital. In the south of the country, where infection rates have been lower but increasing, we are only just beginning to see some effects of the lockdown. But it will be the next week or two as we see those full effects translate through. But of course, what's crucial is that we see hospital admissions and hospital inpatients falling. We're going into winter, the NHS's busiest time. We are continuing all the elective work that we do and trying to catch up on the backlog that was caused by the pandemic over the spring. So it's crucial that we don't have so many patients in our hospitals that we cannot do that work. And that's why it's important that numbers continue to fall, and of course that's why it's important that infection rates fall. So we do need to see the further effects of the measures that we all have to follow, and of course everybody in the NHS is extremely grateful that the public is complying with those measures, because that is how we can all support the NHS in its work.
He'd make a good politician, wouldn't he? Can't get a fucking word in edgeways. Can't even remember what he fucking said half the time. Oh yeah, that was right. Did you notice down the left-hand side? COVID-19 patients in individual beds. Was it individual beds? I can't fucking remember. Oh, independent beds. Independent of what? Independent of the hospital? Independent of the floor? Independent of people? Independent of mattresses? Maybe it's independent of staff. Independent of a test. Just independent. Maybe they're not beds, maybe they're trailers.
Secretary of State.
Thank you very much, Professor Powis. The first question by video is from Ella in Southampton. Ella.
When the tier system begins this week, what are the rules regarding social distancing in an established relationship in a tier 2 area? My boyfriend and I are in a long-term relationship, but we live in separate households, so we're unsure what rules apply to us. Can we see each other indoors, or are we only permitted to see each other outdoors despite being in an established relationship?
Now that sort of question is maybe going to put him on the spot, because he wants to try and avoid the whole bubble situation. Because you could go and bubble each other. You can go and get bubbled at the weekend. But you're also isolated, so there shouldn't be a problem with you seeing each other, really. But he wants to try and avoid that. What he's going to tell you is a shitload of bullshit about following the rules and blah blah blah, when what he actually wants to say is, don't fucking go anywhere, don't fucking do anything. Do as we fucking tell you and stay fucking put. Shut up, stay indoors, give us your fucking money, now shut the fuck up.
Thank you very much, Ella. The rules about exactly what is permitted in each of the tiers is on the gov.uk website, and we're also making sure that it's widely available through advertising. I start my answer with that because for everybody watching, if you're in a specific situation, then the best thing to do is to go and look precisely at the rules. Now, of course, I understand the impact on people who are in a long-term relationship, and we have made specific provision, but the general rule for those who are in tier 2 is that it is the rule of 6 applies outdoors, including, for instance, in a private garden, but indoors you should only be mixing with people who are in your own household. So I hope that answers the question, and I would urge you to go and look on the government website if you've got any query on any of the specific rules in any of the tiers in which you live.
Is that clear enough for you? Don't ask me, I haven't got a fucking clue. All I do is read this bullshit out, spill it out to the fucking nation, spend millions on fucking advertising, waste everybody's time and fucking money, and I can't even give you a straight fucking answer. Ain't that just brilliant? Fucking leadership. Don't you just fucking love it?
The next question from Adrian in Worthing, which has been submitted by text. What provision is there for testing of all students at universities before they return home for Christmas?
There is no provision. They make it up as they go along. The last time students actually kicked off with the police, they had them running all over the fucking country and not being able to use the fucking rubber bullets because the police turned around and said, we didn't use them for health and safety reasons. You might shoot somebody. You could injure somebody. Whilst all the students went round and fucking smashed the place up. Outnumbered and outgunned.
Well, this is a great time to ask this question, Adrian, because today is the first day that we're rolling out the widespread testing of people who are about to return from university. And we want to make sure that people can come home from university, but do that in the safest possible way. So there's a programme right across universities, right across the UK, to ensure that as many people as possible can get a test before they travel. And this is a really...
Well, I know the Army's doing testing, and, well, we're up at universities are doing testing. I've read something on it. I'm going to tell you about how great testing is and how you should do it, but I haven't got a fucking clue, really. I'm just going to carry on reading the shit I got in a memo, and I'm going to stick to the narrative and just get testing because it's a really good help. It gives us a load of data, it puts your name on a barcode and everything. Thank you for that. I ain't got a fucking clue.
Helpful contribution, an example of how the expansion in testing capacity that we've built up over these last 9 months or so can have a real-world impact. And then, of course, there are arrangements in place that if you're at university, your university will be able to give you the details of, for those who test positive, who of course then need to isolate along with their contacts. But that's starting today. Is there anything else that you think we should add? No. So thank you, Adrian. That is the provisions there. And I hope that all students will engage with this enthusiastically because it's so important for making sure that people can get home safely at the end of this term.
There's your answer. If you want to fuck off home, fuck off home. Stop hanging around waiting for fucking permission. You don't fucking need permission.
Next question is from Hugh Pym from the BBC. Hugh.
Thank you, Secretary of State. Testing for students is voluntary and is not available to every student at every university, so how effective can that programme be? And a question for Steve Powis. How worried is the NHS about a new wave of infections putting real pressure on the NHS in January following the relaxation over Christmas?
Get ready for this. It's going to be all panic. All hands on the beds. Blah, blah, blah. The numbers are going to go up. The beds are going to be filling up. Blah, blah, blah. Just like they do every year. Just like it's been coming out of the USA that the beds are running at 90% capacity like they always do every single year. Our beds would be filled the same. What is the fucking... It's like they've even emptied beds so they can tell you that, oh, the numbers are going back up, we're filling more beds up, we're running out of bed space. But most of the people in there have just got snotty noses because they're just symptomatic. They're just symptoms. They're not testing for the fucking so-called virus. You know, that thing that nobody's got. Nobody actually has hold of. Nobody actually has, you know, the full fucking virus. In all this time, they've not managed to isolate it. Been told that they have. But in the spirit of international community and getting rid of this pandemic, they haven't actually shared it with anybody anywhere. CDC's not got it. Stated so. On the documentation on the website. They don't have enough component parts to say this virus is causing what it's doing. That's from July. Makes you wonder, doesn't it?
Thanks, Hugh. So our approach to testing is that it's voluntary. We haven't made testing mandatory. And maybe I'll bring in a general messenger on this approach with the community testing that we're rolling out as well, with the prospectus that's being launched now. Of course, our goal is to get this testing made available to as many students as possible. It is a huge logistical exercise. I'm very grateful to the universities right across the UK who've engaged with us to help to make this happen. It is about making things as safe as possible. And anybody who has a concern about the need to access testing should in the first instance speak to their university, because we're doing this in partnership with the universities. I think it will make a good difference, a good positive difference, but as I say, we haven't made it mandatory because that brings in all sorts of other considerations, and we think that it is therefore best done on a voluntary basis.
Seems to be stumbling there a bit, innit? Can't even big up the fact that testing would be, you know, absolutely beneficial to diagnosing you with something and possibly helping you survive it and get rid of it. It doesn't sound right big up on that, does it? What was that bit about doing it safely? What's not safe about testing? So it can be done safely. What's the fucking dangers, pal? You've already made the big fucking slip up of saying that, you know, you're going to be rolling out a virus. So what's not fucking safe about this test? Fucking start explaining, pal. You're going to be fucking running in a bit.
A general messenger, and then I'll bring in Steve on the second question.
So obviously a really important part of the community testing programme is to try and drive up participation. The higher numbers that we get tested, then the more effective this regime will be. And we think that the best way to do that is to work with the local communities and the local leaderships, because they're best able to tackle where needs are, where risks are, and they're best able to tailor their offer to the local communities that they serve.
Do you hear that? It's an offer. And they serve you. When are you going to start putting them in the fucking place? Stop taking the bullshit, tell them to fuck off, take the shit with them, and tell them Matt Hancock, Boris Johnson, Chris Whitty, Patrick Vallance, COBR, and SAGE are all a bunch of manipulative bastards trying to screw this fucking country over and bring in a dictatorship over a digital ID to tell you when, where, what, how you think and fucking do anything. Shove it up your ass, pal.
So that's right at the heart of this community testing programme, is a partnership that's led from the local level but supported by central help.
Thanks very much. And Steve, on the second question.
Do you notice the look on his face? Facial expressions are very telling. He's up there under duress. He knows this is bullshit. And he can't say a damn fucking word through contract and oath. They're fucking this country over and he's up there being fucking used and abused. Look at his fucking face again. Rewind the fucking thing if need be. I'll tell you what, I'll slot it in again straight after this so you can watch his expression again.
Thanks very much. And Steve, on the second question about the new year.
Thank you, Hugh. Well, as I said when I introduced the data slide, it really is important for the NHS that we get infection rates down, and that translates, as it does, into taking pressure off hospitals, reducing the number of admissions, and reducing the number of people in hospital with COVID-19. And that's for a number of reasons, and I'll say them again. Firstly, unlike the spring, when we were heading out of winter into the summer, we are now heading into the winter. The NHS is always at at its busiest in January, February and into March. We see more infections, chest infections from other viruses and bugs. We see more slips, trips and falls. So the pressure on the NHS builds. So it's crucial going into that period that we have this under control. Again, unlike the spring, we are continuing as full on as we possibly can with all our routine work, our elective work, and we are trying to make sure that we catch up, unfortunately, on the backlog that we had because of the pandemic in the spring. And of course, we've always been open for everybody with emergency conditions, with symptoms for heart attacks, strokes, and we need the public to access the NHS just as they always do. We saw a bit of a drop of that in the spring. We don't want to see that. We want people to come forward.
Yeah, normal stuff, usual routine, year in, year out, yada, yada, yada. But they want you to come in, especially this year. They need you to come in to keep those fucking figures up. Don't forget that. They want those figures that they're relying on to tell you how to do everything. They need them to remain up. So make sure you go in, even though you might catch the fucking thing from there.
So for all those reasons, it's really critical that we keep infection rates under control. Now, clearly Christmas is a special time, but the NHS always asks people to be sensible over Christmas, and we're confident again that people will act sensibly once again over Christmas. They will use the change in restrictions sensibly, and we will go into the new year hopefully with infection rates staying down and falling, and therefore the pressure coming off the NHS at that critical time of year.
Thanks, Hugh. Next question is from Emily Morgan at ITV. Emily.
Thank you, Secretary of State. I've got a question about mass testing. I just wonder how you expect to have the same success you had in Liverpool if you're not going to give the councils the same sort of resources. Coventry Council have told us that they feel like they've simply been left to try and work this out themselves, and it will cost them £1 million. Will they get that sort of money to be able to do the community testing you want them to be able to do?
Well, yes, in the prospectus that we're publishing right now, it includes extra funding for local authorities to do this testing, up to a figure of £14 per test done. So that's quite significant extra funding that's available across the UK for councils that want to make this work on the model of Liverpool. And I'll ask a General Messenger to set out more details of how we can make it work, because this community testing approach is so important to finding the cases that we haven't yet found, and so reducing the number of infections, which obviously is critical for everybody.
You do realise that funding is the national debt. That's going in your pocket, straight out from your taxes, straight out of your pocket, of your job, wherever you're working, straight into that. And then they're going to say, you need to pay it back. No, don't think so.
So firstly, we're trying to move away from the term mass testing. I think this is about community testing. It's about tailoring it to the needs, as I said, of the local area, and that might be geographically specific, or it might be ethnic community specific. And I think the Secretary of State's right when he says the prospectus, which will be public from now, will set out a great deal of support and a great deal of signposting for what is on offer to these local authorities.
Remember, it's an offer. It's already going to cost you money. The councils are going to, essentially, get this as a fucking loan. So, essentially, your council tax is going to go up. They're going to find some way of slipping it in there because they can't get it back from people who are working because there's not enough people working to collect taxes. Mind you think, no council in this United Kingdom has actually received money from the government above what they get from the council tax. Not one damn penny, unless they're claiming for it, and that money goes straight into the national debt. Do you see the problem with this country? It doesn't make enough money to pay its own fucking bills each and every year. Yet we keep being told about the whole GDP and all the rest of it. It's all a fucking bunch of bullshit. They're creaming it off the top and running this country like a fucking credit system. They've been doing it since day one, and they're still doing it. If you've not fucking twigged this yet, you need to fucking start doing.
And one could easily see an arrangement where we're setting up some small, local, targeted community testing sites, but equally, when a community wants to target broader swathes of the population, something larger, something more sort of ubiquitous, tackling larger swathes of the population. It really depends on where the need is, and will be driven by the local leadership and the local directors of public health. It's important to talk about the workforce here, I think, because as you rightly point out, Liverpool was delivered primarily by a military workforce. And I'm not speaking as part of the Ministry of Defence, I work for the Health Secretary on the community testing programme, but I can say with confidence that that cannot be replicated around the country, and therefore the military support, along with all other central support, has to be targeted where it's needed most and where it can have the greatest effect. So I have absolutely no doubt that the military will continue to play a really important part in the community testing programme, but the baseline assumption in terms of workforce generation is that that will be delivered locally with considerable support from the centre. And from what I've seen of a number of local communities, there's great ingenuity already underway in delivering that workforce. They're accessing the volunteer force, they're working very innovatively with the private sector, and yes, of course, they've got good liaison with local leadership in the military. So that is our starting assumption. As I say, I have no doubt that the military will play a prominent role, but the idea that it can be a wholesale offer to all local authorities is simply undeliverable given what the military are doing already.
They're spread out a bit too thin, aren't they? Not enough staff. So they're not going to be coming round giving it all urgy-burgy and everything, are they? Because if the public decide they've had a fucking enough and they decide to take to the streets, they're going to be fucking screwed. Seriously. Because they've got all the little fishes to be dealing with over in the likes of the Middle East. Or with the likes of the North Sea, paddling around because fucking Russian warships are fucking floating around. Because they're allowed to, so we've got to go and watch them. But I'd watch where that B-52 bomber's just turned up over fucking Israel, I think it was. We'll have a hand in that. Don't you fucking worry.
Thanks very much. Andy Bell from Channel 5. Andy.
Hi, Secretary of State, thank you very much. Realistically, is there any chance of any part of England being able to move down a tier this side of Christmas? There's meant to be a review in a couple of weeks' time. Isn't it much more likely that anyway we'll have to wait until well into January for any chance of moving down a tier, because we'll have to work out what the effect of the Christmas relaxation has been?
Not necessarily, no. We'll look at the data on the 16th of December and we'll announce the results of that review on the 17th of December. Of course, we've got to take into account that Christmas is coming up, but nevertheless, with the case rates coming down as they are, as I said, coming down by almost a third in the last week, then we will be absolutely looking at each area and seeing what is the right tier for that area. I want to see areas that have pulled together, followed the rules, got the case rate down, like Liverpool has over the last month, which has led to it going into tier 2.
Hold on. They actually ran, supposedly, a better test. So the numbers were down by 3/4. So you don't even know what you're fucking talking about, do you, you complete prick? Can't even get your bullshit right. I mean, come on. At least emphasise the fact that you're using a different fucking test and not the PCR test, which is a bag of shit and it's not fucking diagnostic in the first place. You're a fucking complete arse. And if this one isn't even anywhere near as close as the fucking PCR test at doing its job correctly and diagnosing something, it's definitely fucking better than the fucking piece of shit you were fucking using before. So you can't even promote that as a fucking thing for fucking more people fucking taking it up. No, you got to stay where you are, do as you're told, follow what we're telling you and what we fucking say. It's got nothing to do with a fucking test result whatsoever fucking ever. The proof is in you reinstating and completely fucking going over and over this same bullshit each and every time you open your stupid, retarded fucking trap. Do as we say, or else. It's got fuck all to do with fucking test results. Your own fucking words fucking let your fucking lies loose, you complete fucking prick.
I want to see that happening much more broadly. There are some areas of the country that I'm worried about. There are some parts of the country, small parts of the country, where the numbers are still going up. So we do have to be careful and we have to be cautious. But the first review will be on the 16th of December. We'll look at the whole of England at that point, and then we'll continue to review regularly after that. Thanks very much. Next question is from Jim Pickard at the FT. Jim.
Secretary of State, you say today that there's nearly 16,000 people in hospital with COVID. Can you say what proportion of those are in hospital because of COVID, as opposed to people who are in hospital for other underlying reasons such as cancer, or they've broken a leg and they happen to have COVID?
Go on, lad, put him on fucking spot.
And that's been picked up. And also, Nadine Zahawi, the new vaccine minister, has suggested that people who refuse to get vaccinated could be not allowed to visit restaurants, bars, cinemas, and so on. Is that kind of stick approach something that you agree with?
Well, of course it is. Of course they agree with it. Why do you think they'd be bringing out a fucking airplane passport fucking bullshit and a QR code fucking pass and all the rest of that fucking certified shit that fucking Bill Gates has been on about for fucking donkey's years? Of course they fucking want people to fucking have this fucking test and not go out anywhere unless they've got a little fucking certificate. Do you want to know why they want the certificate? They want to know why it's called a certificate. Because it's got a monetary value and they apply it to you. Just the same as the whole birth certificate bullshit that you end up signing and agreeing to when you get your national insurance number. It's part of a fucking bonded contract. You're agreeing that you signing that fucking number is you on that child's birth certificate. And that child's birth certificate never changes throughout the whole of your life. They treat you like fucking children.
Thanks very much. Well, I'll ask Steve to answer the first one, and then I'll answer the second question. Steve.
Yeah, so the vast majority of people, when we have a pandemic and the infection rates are high, are in because of the direct effects of COVID. We do see people in hospital with COVID when infection rates are high who have not been admitted because of COVID. So as the Secretary of State highlighted, about a third of people have COVID without any symptoms. So we have for some time in the NHS been testing everybody who gets admitted for COVID to pick up whether they have it or not. And of course, as infection rates increase in the community, then the chance of picking up asymptomatic individuals as they come into hospital increases. So we certainly do see cases of individuals who've come into hospital without COVID who then test positive.
Did you catch that? A number of people who go into hospital without COVID then test positive. Funny that, isn't it? Didn't have it before you went in, but you've got it once you get in though. And that wasn't asymptomatic, he already explained that before that. This is about COVID. Didn't have it when they went in, got it when they went in. I told you.
And that's why we've got very detailed infection prevention and control measures in. We not only test people when they arrive in hospital, we test people after they've been in hospital for a few days, because it is also possible that when you arrive, you may test negative. So we're very careful to ensure that we're testing people on a regular basis in their first week in hospital, because that keeps patients safe, it keeps staff safe. But the important thing, of course, as I always say, is to get infection rates down, because the lower the rate in the community, the less the chance is that you will be admitted into hospital for some other condition and turn out to test positive for COVID.
Because you might be in there for a week and you might test negative, but when you're in there for a week, you might end up testing positive. I fucking said this last year about the idea of why 5G has been stuck in fucking hospitals and schools in the preliminary fucking rollout. Because it has an effect on the human body. It's been fucking studied and shown, even with 4G, it has adverse effects with the human fucking body. This, what they're going on about, is fucking one of them.
And on vaccines, look, our overall approach on the vaccines is firstly that we do not plan to mandate the vaccine.
Of course you don't. You don't plan on mandating it because the whole idea is commercialising health. You want consent. They want you to take it up by your own admission of, yes, please give it to me. See, and we're still under the Human Rights Act, which, don't forget, these fucking manipulative cunts tried actually fucking getting rid of this year. On about, we don't need to be signed up to it. So if they got rid of it, they'd be acting just like fucking China. Do what we fucking want and screw the fucking people. You will do it, or we'll really fucking punish you and just fucking wipe me out. This is also the same reason why they've been looking at actually making it fucking legal so that undercover police can commit acts of crime.
We think that by encouraging the uptake of the vaccine, we will get a very high proportion of people in this country to take up the vaccine, because of course it protects you, but it also helps to protect your loved ones and your community. On the question of what happens once you've had the vaccine,
don't forget the guilt trip. It's not just about you, it's about everybody else. Even though it all comes down to you and your immune system and nobody else's, whether you actually survive sort of shit or not. Or whether you actually need some form of vaccine or inoculation or whatever to stop something from happening to you. It's not about you, it's about everybody else, you know. Not forgetting the guilt tripping. It's about the community. You know, that thing that this government has had its hand in destroying for the past, 40 years plus? And now it's on about having a global community. Talking at the fucking arse. They can't even get things right in this country now, and they're on about going fucking global with this shit. It's gonna be a fucking joke, I tell you.
Now, of course, in the first instance, we do not yet have reliable data on whether a vaccine not only protects you, which we do have a high degree of confidence, subject to the MHRA that I was talking about in my comments. We do have a high degree of confidence that the 3 vaccines so far protect the person who's been vaccinated.
Oh, wait for it. We've got some confidence that it actually protects you, but we don't know, because if you get the vaccine and you don't have symptoms, it could just be your immune system working. You've been given a peg up. But if you're still producing the vaccine, that means your body's still reproducing it. See, if you get a virus and it kills it off, it destroys it, it doesn't get reproduced. So it dies off. Doesn't mutate, it doesn't keep being made. Because where does the mutation come from? Well, it comes from you, your immune system and body mutating it so as it can combat it. Because otherwise it doesn't mutate. How the hell would it mutate? Well, the only other way would be when bacteria has its hand in it. But I don't think bacteria is actually doing anything with this. This is all down to you and your body, don't forget. Because it's talking directly with your DNA now if they make a vaccine. So they're going to make a vaccine that actually rejects something in your body that should kill it off because it won't be being reproduced. So if it's not being reproduced, the viral load will just dissipate and die out and won't be any use. But they're not telling you that. They're telling you that you could end up infecting someone else. So this vaccine does fuck all. It's essentially, it's next best thing to a fucking placebo.
But the impact on whether you transmit the virus is not as clear from the data so far, and therefore, in the first instance, our approach will be to watch the indicators that we watch all of the time, the case rate amongst the over 60s, and the positivity rate, and to see the impact of that on the vaccine and the vaccine program on the pandemic.
If the receptors on a virus don't actually connect, your body doesn't actually strip it down, break it down into its component parts, reproduce it, and then act upon what it's actually read. It's that simple. It's like opening a fucking fortune cookie. If you don't open the fucking thing, you can't read what's in it. So if your body's not actually opening the shell that this fucking virus is in, it's not fucking doing anything. It's not fucking reproducing it because it has to open it to reproduce it. This fucking pleb has just told you that they haven't got a fucking clue. It doesn't do anything with the fucking virus, it just gets rid of the fucking symptoms. This is what people have been on about since fucking day one. This virus is next to fucking nothing. Get it through your fucking head. I had to do some serious fucking hours reading up and fucking watching videos and all sorts of shit to fucking find that out. That if you have a virus, it comes in a shell. The spikes on the shell are what your body connects to. Your DNA strips it all open, strips open the fucking chromosomes and all the rest of it, fucking reads it all off, chops it up into sections of 3s and 5s and fucking reads it all off and goes and acts upon it. Now, if they're telling you that they've created a vaccine that rejects the virus, that means that that virus cannot be fucking reproduced, which means you cannot end up fucking transmitting it to somebody else because eventually it'll just die off. It will just get eaten up, used up, ejected from your fucking body and go off into the world and fucking die. But apparently you're going to be infecting people. Well, how the fuck are you going to be infecting people if you can't reproduce the virus? You can't get the shit straight.
Now, having said that, for a long time now, we've been looking at the questions that Minister Zahawi was talking about, and the question of what's the impact on the individual in terms of what they can do. And I've talked about that at press conferences like these months and months ago. And so that's what Minister Zahawi was referring to. He is a great appointment, and I think will bring a huge amount of support and scrutiny to the rollout of the vaccine. I think he's going to do a brilliant job. He's already been working on the vaccine on the business department side of the fence, and I'm really delighted that he's joined the department today.
Was that the Minister for Business? Yeah, him who couldn't actually answer a question. He spent 3 minutes not answering a question. Twice it was put to him. Second time to make it a bit clearer so he could actually answer it. And he still couldn't fucking answer it. Because you're all full of shit.
Next question is from Kate Pickles at the Daily Mail.
Thank you. We have heard concerns from the Faculty of Public Health about the enormous resources required for mass testing and the suggestion that it could detract from the vaccine programme. Firstly, I wondered how you'd respond to that and how confident you are that the two things can successfully run alongside one another. Secondly, is the expansion of community testing an admission that test and trace hasn't worked as well as you would have liked? And how can you envisage test and trace changing as a result of this new programme?
Thanks very much. Well, I can reassure you on both counts. The first thing is that the community testing programme is a big expansion of what we can do within NHS Test and Trace. And it's only because of the work of NHS Test and Trace over the last 9 months, the work of the team that has got these massive new testing capabilities that allow us to make these expansions. So the work of NHS Test and Trace has been absolutely critical in getting us to this point when we can roll out such widespread use of the tests, for instance today to university students, and then, as General Messenger was saying, more broadly to the community working with local directors of public health. On the first part of the question, the key point is that
Bitch, that's you off my fucking Christmas list. Strike, strike.
Testing and vaccination need to run alongside each other.
Mass testing and vaccination. Yeah, that's not going to get taken up, is it? One, they need your consent. Shitloads of people aren't fucking happy with this government and the bullshit they've been fucking pulling. Loads of fucking people have been seeing through all the fucking shit they're fucking throwing around. Even the fucking internet is fucking ablaze with the whole, oh, we're going to go out and we're going to set the army onto fucking cyberspace. Then we can get them to act like fucking trolls. Yeah, I've come across a few of them. Yeah, I wonder if they got the P45 yet. Them scripts working? Because they're fucking not with me, pal. Definitely not. And then we get the whole, oh, test and trace. What a fucking absolute bastard failure that is. All they want you to do is ruin your device so you'll go on to the next new one because it's going to have maybe a slightly better battery so you can have your Bluetooth on 24/7. They also just want it to gain access to your fucking device, your bank account, all your apps, all your information, because they require your acceptance to it and the sharing of data. This is all they're fucking doing it for. They just want to get on your handsets and onto your fucking data and all your details and collect as much shit on you as they can. Period. That's all they're after. Even the banks, if you've got a banking app, virtually all of them want access to your social media. So they can sell you shit. This is all it's all about. Selling you shit. But they want your data for free. They don't want to provide anything. The only thing they're going to provide is a stick in your fucking arm and a shitload of guilt if you don't fucking take it up. That's all they're fucking doing. And it's all fucking falling through. People aren't fucking falling for it.
This has already been happening. For instance, in the vaccine trials, we also tested repeatedly some of the people within the trials to find out if they picked up COVID. And that's one of the ways that you can find out if a vaccine can work. And especially because once you've taken a vaccine, it still takes some time to get immunity through the vaccine, not least because you have to have 2 doses, that it's critical that we have the testing programme running alongside the vaccine programme, and so they are designed to be symbiotic. I'll ask General Messenger to say a little bit more about this, but the last thing I'll say on it is this. The rollout that we can announce today of the community testing programme is a sign of the success of NHS Test and Trace in delivering the massive capability that we now have to be able to keep more people safe and to find this virus and to get it under control with the minimal negative impact on people's lives that all of these things have.
Oh my god, what a fucking con! We're generating a vaccine that takes time for you to build up immunity to it. Even when you've got it, we want you to carry on testing to find out if you've got it. What was it he said on Talk Radio? To roll out the virus. You take this fucking vaccine that supposedly fucking stops it. No, it fucking doesn't. It's telling you right there and then. It doesn't fucking stop it. You can have the fucking vaccine. It's not going to do anything to stop your body fucking replicating it. Because it's your body that replicates it. Nothing else. It doesn't breathe, it doesn't eat, it doesn't drink, it doesn't shit, it doesn't piss down your fucking trouser leg. It doesn't do jack shit except sit there inertly doing nothing. Until your body replicates it, it does jack shit. And they're telling you that they're giving you a vaccine and you've got to keep testing. The vaccine does nothing.
General Messenger.
Well, I'm all of 3 weeks in, but my experience thus far absolutely supports what the Secretary of State says. The importance of alignment with what Test and Trace have achieved so far, the vital nature of the alignment with the vaccine. We have to ensure that those are synchronous and not competitive. I can tell you how supportive colleagues have been in the Vaccine Task Force and the Test and Trace. Their experience, their skills, their knowledge has been vital as we've looked to build this community testing proposal. So to me, that alignment is there, but we're absolutely certain that we cannot allow each other to disrupt or deflect from the important business we're all doing.
I bet he pulls another face. Keep your eye on it. He'll pull another face. But do you notice? It's all compartmentalisation. All of these little groups are all doing it all for the benefit of everybody. That's what they believe they're doing. It's what everybody believes they're actually doing in this whole system. They're led to believe that everything's for the good of everybody else. But at the top of it is a bunch of manipulative bastards who want, essentially, for the rest of the fucking populace to fucking provide for them. Period. It's been the same fucking agenda for thousands of years. Certain people at the top get everything, while everybody at the bottom doing all the work get next to fucking nothing. It's the way it's fucking gone on. The problem is now they've got enough people around the fucking globe that we don't actually need to actually run the system like that anymore. So they're changing the system in way that it works, so that to do anything, you end up being completely fucking restricted. If you do not toe the line, you will be persecuted. That's the way they want to fucking run it. They haven't been persecuting people before because you've had the whole law and order thing. Well, now it's not. It's going to be the rule of law. Law and order is becoming rule of law. There's a slight difference. Not only small. Wee small. But it's one of the biggest differences that lets you know whether you've got any freedom or not. They don't want you having any freedom. They don't want you having your own opinion, your own thoughts. They don't want you speaking about it. They don't want you talking to others about it. They want to manipulate the whole fucking thing. Never go and look at anything they don't fucking support. Don't read anything. Don't have your own ideas about anything. Don't go and look at anything that they don't actually fall into line with. Otherwise, we're going to make legislation, rules, laws, regulations, and we're going to persecute fuck out of you. The first thing that came up with was with this coronavirus, and anything you do as a normal human being going out into society, they decided to slap a fucking fine on it. Fine because they're okay with it. Fine because they class it as a duty, because they're providing a service or benefit. The service or benefit you're not the recipient of, they are. That's why they're fine with it.
Thanks very much, Kate. The final question is from David Hughes at the PA. David.
Secretary of State, tomorrow MPs will vote on these new tiers arrangements. The impact assessment the government has published today makes clear that without restrictions, the NHS could be overwhelmed. Given that, are your colleagues on the Tory benches who are thinking of voting against these measures acting irresponsibly? And for General Messenger, 23 million people will be going into Tier 3 this week. What sort of proportion of those people would you expect your community testing exercise to cover?
Let's cut straight through the bullshit and let's have some real fucking answers for these two fucking questions, shall we? I don't think we're going to get them, to be honest.
Thanks very much, David. Well, I would urge all MPs right across the House to vote for the tiered system. The tiered system has a lower set of restrictions than the national lockdown in all 3 tiers, but it's also more targeted so that the areas where the prevalence is lower and the pressure on the NHS is lower have fewer restrictions, which means that people can do more in terms of going about their normal lives, and obviously has a less detrimental impact on the economy. Unfortunately, though, we do have to have the higher tier restrictions, and in particular tier 3 restrictions, in place so that we can have confidence that we can keep getting this virus down and then keep it under control right across the country. And that way, it is the best way to avoid a 3rd lockdown, and it is the most proportionate way to take the action that we need to keep people safe and to stop the NHS being overwhelmed. So I hope that we get a very significant proportion of MPs from all parties voting for the proposals that we'll put before the House.
Don't forget to mention the economy. What economy? It's going down the fucking Swanee. I mean, if it was any fucking lower, it'd be below a fucking tide line. Well, that's right, we don't have a fucking real fucking economy anymore, do we? No, because it's all running on fucking debt. The national debt. What is it? 2.5, 3 trillion now, is it? Did you manage to replace that 330 billion you took out straight away? Because I heard it got put back. Only I don't think it did, to be honest. Well, you can't really put back what you never fucking took out. Because that's the way the system works. You can't just magically produce money. And seems though they don't really store money in the treasury. Or was it Venezuela's gold you used? You know, just like the US did after they stole it. You know, under the, what was it, sanctions. Yeah, book fiddling. You know, you should know all about this because you're an accountant. Yet you can't even do fucking numbers for tests. What are you doing, honestly? Don't know, do you?
Tomorrow, I don't know, Professor Powers, if you've got anything to add from the NHS side, and then I'll ask General Messenger to answer the second question.
No, simply to reiterate the importance as the NHS goes into its busiest time of year to ensure that infection rates are low and are falling, because as sure as night follows day, that is 2 weeks later, unfortunately, more hospital admissions, more people in hospital, more pressure on NHS services, and of course, unfortunately, more deaths, and increasingly, as we understand conditions such as long COVID.
I wonder how much of a bung he got from fucking Hancock to fucking say that. Oh, fucking hell. This reminds me of fucking Saturday morning fucking kids programmes back in fucking 80s and 90s. Where you get celebrities going onto a TV show in any sort of interview and mentioning a specific word as a fucking duh. Fucking long COVID. Oh, what does that actually mean? Go on, fucking explain it. What does it mean? Long COVID. Oh, you've had the virus for a while. Yeah, that's because your body's fighting it off and it's sticking around for a while. And it's not fucking doing its ultimate to fucking get rid of it. And it could put you in hospital, just like it did maybe when you first got it. It's you know, you get lags in things. You know, like the 2-week lag in test figures. Really? I thought these tests were all that much quicker and everything. Yeah. Must be wrong somewhere. I mean, don't they computerise everything now? And it still takes 2 weeks for figures with all the supercomputing they've got. You know, they mustn't have enough computers with Excel running with enough windows open to hold all the figures. I wonder if they're still on the ZX81 or BBC Micro B.
More long-term health problems for people. So the key, as always, is to get infection rates down and to ensure that they continue to stay down.
Thanks very much. General Messenger.
David, I don't know how many of those 23 million we'll be able to reach because planning is still very much underway. And as I said, the nature of this will vary from region to region and from area to area. We're alive to the possibility that we will not be able to do this all at once, but we assess that local authorities are at varying levels of preparedness and readiness to do this, and therefore I can see this as an offer that will sequence over time and into January and beyond. The priority that we accord, the levels of support we give, will be based on the infection rate, how long those areas have been under harsh restrictions, how mature their plans are, how ready they are to deliver them. And that's the business of the next week or so, is to try and identify some front runners and to lean into support of them so we can have a quick early impact. But as I say, I can see this being sequenced over time.
Bit like Luke's there again, isn't it? That whole... It's a bit telling, that. Sorry, mate, but yeah. But the whole... It's not going to roll out. You know why they're actually talking about this now, and this whole rollout? Is because everything's on the last minute and they're waiting for this NGO department to actually pass this vaccine off. If you haven't heard anything about what's going on in Canada over their vaccines, it is fucking hilarious. They are not set up at all for fucking anything. They haven't even got anything tabled for the vaccine to be even produced in their company, even under licence. That's how, you know, you sort of manage to get vaccines produced within a country when it's actually, you know, invented abroad. You get it licensed to be produced in another country. You see, they don't want all this shit getting out to everywhere because they don't know how secure it's going to be. Because if somebody else gets hold of it and finds out there's nothing in it, well, there'll be fucking hell to pay. Canada's quite pally with Chinese, to a degree. Even to the point that they've actually allowed the Chinese citizens in Canada to take up arms and protect their property against any invaders. Now, you'd say every person has a right to do that, which they would do, but they've specifically written it into the law. Now, because of the way the Chinese government works with its people are the property. They own them. And wherever their business interests lie in any other countries, they go and make sure the military goes and backs them up. Canada just may have opened themselves up for one hell of a holy fight on their hands. Probably why they haven't got any licensing to actually produce a vaccine in their country, because of what they've actually put into the law over there. Politicians and their ideas, eh? Yeah. Can't be fucking doing with them, because they just keep fucking lying to each other when they're all trying to be pally and friendly and fucking get control of everybody around the fucking globe together. And they're just too fucking underhanded and fucking twisted for their own fucking good. It's fucking hilarious. I'm watching it all fall apart. It's brilliant.
Thanks very much. The only thing I'd add to that is that I'd urge all those council leaders, directors of public health, and those in the devolved administrations who want to take up this offer that's set out in the prospectus, those within the Tier 3 areas in England and the DAs with whom we've been working, to come forward with their proposals. Often they know their communities best, and so we want to work hand in glove with local directors of public health, with local authorities, and of course with colleagues and MPs who represent those areas, to make sure that we can use this community testing programme as effectively as possible to root out this virus, and also then, hopefully, to free up people to be able to do some of the things that we love. And that way, we can better get through this together. Thanks very much indeed. That ends today's coronavirus briefing from number 10 Downing Street.
Remember, end on a smile.